think a lot of people might be a bit apprehensive about approaching the topic because it's quite personal. My name's Josh. I'm a new junior doctor at St Charles Gardner Hospital. In the long term, I'd like to go into GP practice or general practice, and as a GP you have a lot to do with treating, investigating, monitoring blood-borne viruses.
What exactly is BBV screening, and why is it especially important for pregnant people to get screened?
So BBV screening is a series of blood tests where we look for the three main blood-borne viruses, which are hepatitis B, hepatitis C and HIV. We look at the levels of either the virus in your blood or the molecules your body makes to fight the virus, the antibodies. It's particularly important for pregnant people to be screened for blood-borne viruses, basically to ensure both the pregnant person and the baby have the best outcomes in pregnancy.
So what potentially could happen if pregnant people don't get screened for BBVs?
The risk of pregnant people not getting screened would be poorer health outcomes for both the pregnant person and for the baby. From the point of view of the pregnant person, pregnancy takes a large toll on your immune system, and it can very severely suppress your immune system. As a consequence, patients with a blood-borne virus might experience a flare of, let's say, the hepatitis, for example. So it's important that we pick that up in that instance to make sure that the pregnant person is healthiest they can be during pregnancy. Blood-borne viruses are also linked with increased risk of developing adverse pregnancy outcomes, such as miscarriage, preterm birth, low birth weight, and gestational diabetes. So that's from the point of view of the pregnant person, and from the point of view of the baby, mainly you're trying to limit the risk of the blood-borne virus being transferred from the pregnant person to the baby. Secondarily, infection with a blood-borne virus at such an early age is also linked with other adverse health outcomes like developing diabetes, developing cardiovascular disease.
Do you have any tips for pregnant people who might be a bit hesitant or reluctant to get a BBV screening at the hospital?
First and foremost, the earlier we detect any kind of blood-borne virus, the better, because it means the earlier we can start treating it and reducing the overall level of that virus in the bloodstream. I think a lot of people might be a bit apprehensive about approaching the topic because it's quite personal, and to that I would just say that while it might be quite intimate and personal to you, for a lot of doctors it's very everyday. If it's any reassurance, we're very experienced with dealing with kind of sensitive topics of conversation like that. And if that is not enough to alleviate your kind of anxiety, I would say more than welcome to bring in a family member or a friend to any kind of consult with the doctor. And if someone like that isn't available to you, we might be able to offer you someone like that, whether that be something like a social worker or an Aboriginal liaison officer.
Thanks so much for talking to us, Josh. We learnt so much about BBV screening in the hospital, so we appreciate it. Thank you.